Why is extrapulmonary TB diagnosis challenging? Imagine trying to find a tiny needle in a massive haystack. That's similar to what doctors face when diagnosing extrapulmonary tuberculosis. Unlike lung TB, which shows clear signs like a persistent cough or weight loss, extrapulmonary TB can affect almost any part of the body outside the lungs. It might involve the lymph nodes, bones, kidneys, brain, or other organs. Because of this, symptoms can vary widely and often look like other illnesses. For example, if TB affects the spine, it might cause back pain, but that can also be caused by many other conditions. This makes recognizing extrapulmonary TB tricky, especially since symptoms are often mild or nonspecific. Another challenge is that the bacteria causing TB are usually present in very low numbers in affected tissues. This is called being paucibacillary. When bacteria are scarce, traditional tests like microscopy and culture become less reliable. These tests are considered the gold standard but can take weeks to produce results and might not detect TB in extrapulmonary sites. Getting a sample from the affected area can also be difficult. For example, obtaining tissue from deep inside the body often requires invasive procedures, which may not always be feasible or safe. Healthcare providers may also have less experience with extrapulmonary TB because it is less common than lung TB. This can lead to misdiagnosis or delayed diagnosis, especially in areas where advanced diagnostic tools are not readily available. While newer molecular tests like nucleic acid amplification tests have improved detection speed and accuracy, they are not yet available everywhere and can be limited by sample quality and the site of infection. All these factors, variable symptoms, low bacterial load, difficulty in obtaining samples, limited experience among providers, and resource constraints, combine to make diagnosing extrapulmonary TB a real challenge. This often results in delays in treatment, which can increase the risk of complications. That's why maintaining a high level of suspicion and using a combination of clinical judgment, advanced testing, and sometimes invasive procedures are essential for accurate diagnosis. If you or someone you know suspects TB, it's always best to consult a healthcare professional who can evaluate the full picture and recommend appropriate tests and treatment options.